Thank you, Voice of Healthcare, for inviting MediBuddy. So, a quick background about me is I did my engineering. I'm actually an engineer. I graduated from IIT Madras. After IIT, went and worked with Philips Healthcare. So, my introduction to healthcare happened at Philips. I was in the design of cath lab machines. So that's also my introduction to healthcare, and spent a lot of time with doctors, hospitals, patients, operation theaters. And after that, left Philips to start a digital healthcare platform that makes sure that enables high quality healthcare and ensures that is accessible to people across the country. So today, MediBuddy is a end-to-end digital healthcare platform. Patients can come do a video consultation with the doctor, also book appointments and go to the hospital, but also get their medicines delivered to your home, get your lab test done, and all the way you can actually get admitted in a hospital, and that's called IPD. So all the way from a doctor consultation on video till getting admissions. And we are very happy that we've been able to help more than 35,000 patients daily now. So on a daily basis, people across the length and breadth of the country come and use MediBuddy. I think at the same time last year is when we sort of had our lockdown being announced, and then everything actually went into a big challenge at like one fine day, right? So what happened after that is, from a customer point of view, there's a lot of anxiety. When you look from a patient point of view, there's a lot of anxiety because like Dr. Santosh rightly pointed, some of them are worried about COVID, but a lot of them are also worried about other health issues that they had and they could not reach out to a doctor. And if you remember, the whole of the first quarter, or maybe towards the second quarter also, a lot of surgeries had to be pushed down. So a lot of them could not even come back to their planned surgeries, or even go, and unless it is very, very critical, they could not go to the hospital. So there's a lot of anxiety from a, let's say, patient or a customer point of view, and but clearly reflected in the kind of demand for meeting the doctors. And kudos to all our doctors, because they were actually in the hospitals, but of course patients were unable to sort of travel. So one, the technology platforms really help, and I saw three key changes now that we are like 1 year into the system. The key changes that I saw was primarily on three areas. One, customer behavior. So even before this, even though there were telehealth solutions available, adoption to them was primarily by smaller town people because of distance or geography as a problem. But as soon as COVID happened, a lot of digital healthcare actually enabled not just the small town people accessing the big city doctors, but also, let's say, even if you're in Bombay, even if you're like 10 kilometers from Hiranandani, but you still have to do a video call now in the process. So that's when the customer behavior actually really changed and improved. Two is, we had to frantically help a lot of doctors, a lot of hospitals, a lot of healthcare institutions to bring up the technology solutions. Though a lot of doctors are convenient and know how to use the technology, but they still needed a software, they needed a computer, they needed the right set of cameras. So it might be operationally simple, but think in lockdown, you're trying to arrange computers across the country and the right systems and internet and all of them. So the key second point is doctors also like quickly adopted, and a lot of hospitals rolled out. Maybe Reliance and Hirundani would have already had all these solutions, but a lot of other hospitals actually really deployed them very fast. So the key change was doctors and hospitals sort of rose up to the occasion, adopted a lot of technologies and implemented them pretty fast, and also trained their doctors as well as lesser nurses to support in the transitions during that time. And the third key change that also happened was government came up with regulations as well as clarifications very fast. We had a peak in online consultation. It came down a little. So now it's settling at 1%, one certain percentage, which means the baseline has shifted significantly. And going forward, you'll start seeing a gradual uptick in the number of consultations that's moving online. So one was primarily on the technology and how technology has to be sort of robust, let's call it that way. So now there are two parts to this, because suddenly a lot of this happened and the only access was either a computer or a mobile phone, and then most of them had actually only, of course, customers or patients have only a mobile phone. So you have to build all of the solutions to match at the mobile phone capabilities. So an Android or an iOS, or if you have a computer at home or a laptop at home, you can sort of do that. So a lot of work had to be done just on getting the basic application running, and though we had done a lot of work at the back end earlier itself, but there was like significant demand that came in, and then a lot of work had to be done on what is called a scaling for us. And broadly we see that generally also we see that video calls is what is more comfortable, and though audio calls can still be done, but that's pretty easy, but a video call is what we always wanted to enable, so that the customer or the patient can see the doctor can see the patient, and there's at least some amount of a human connection or human touch that is coming across. So that had a few issues, and there's always a lot of scheduling conflicts that came, but I would argue that most of these are the early teething issues that came in because the scaling on technology side had to happen, and doctors as well as the paramedics also had to get used to it. I keep saying paramedics because doctors are like very busy between multiple consultations, and a lot of paramedics have to sort of support them in enabling the consultations happen in a very seamless manner, and they also do between a few of them, they're doing online, and there are one or two patients offline, and they have to like sort of match all of this. So broadly on the technology, a lot of this got sorted in the first 2 months, I think, and by the time a lot of them were comfortable on both sides, right, including very small things like getting very stable internet connection, fast internet connections, all of that is also sorted. The second one is more about the experience of the consultation. Now what you have to also understand is before COVID, a lot of departments were already using teleconsultations very effectively. It can be psychology, psychiatry, dermatology. All of them were actually already amenable in a very simple way, and a lot of the learnings had already come into our platform. But suddenly, as after COVID, every department had to start doing it. So there are always very nuances in every department, and how a doctor looks at it, what is he looking forward to, and what are the kind of reports that he wants. Because uploading an X-ray is a tough thing, because DICOM images are very, very difficult. Then you have to figure out how to make it on a camera and then upload that, because you're still getting a good quality image, but may not be as quality as a DICOM one that you would see. So department specific changes had to be made in order to enable efficiency on both the doctor and the patient. And the last one I wanted to talk about was, so let's think like this, right? Medicine by itself is like a 2000 year plus practice, right? Science that has been practiced. Now think, and a lot of these cues that doctors get is actually because they see you in person, and they see you walk in, they see you walk out, how you behave. All of this actually gives a lot of cues to the doctor. But suddenly when you move all of this online, a lot of changes had to be done, and we have to give this technology platform some amount of time, right? All of them will actually get up to speed. So what has been learned over the last, let's say, 1000 years of science is now like cramped into 1 year of technology. So I would say that that's why a lot of these small issues were there, but all of this also will get sorted in the coming years. And that's why we strongly interact with a lot of doctors across online, offline, and get a lot of these feedbacks and say, what else will give you the right kind of cues? And can we like 100% replace offline with online? No, we can't do that, right? We have to find the right midpoint, and that is essentially the key one. And at least are we able to also identify? We did a lot of work on identifying what is called as red alerts. If there are 3, 4, 5, 6 red alerts, immediately the consultation is clarified that, hey, this cannot be done online. You need to like immediately come and meet me in the physical world. So these are all called as SOPs, standard operating procedures, that we have built in every department.